All right, everyone, it's 2:32. I think we can go ahead and get started. Um, my name is Nick Milo. I specialize in EMR, PCM, PDOC, and ITS, and today we're going to be going over clinical panels and a brief overview of the EMR. I have everybody on mute for now, but if you have any questions, please feel free to ask them in the Q&A field within the Zoom meeting, and we'll go over those at the end of this presentation. So just an overview of our agenda. I'm going to briefly go over the panels within the EMR. We'll then go over an introduction into clinical panels. I'm going to go over some of the benefits, its functionality. We're going to walk through the clinical panel dictionary and set up a build and review that. And then we're going to go over clinical panel groups, which can be attached to that clinical panel dictionary. And I'll show you some user accesses and preferences. So what are clinical panels? Well, instead of having to enter each of the clinical panels to see information within the EMR, a user can choose to have information that is important to them display in this one-stop shop location. It's a way to combine all the panels in EMR into one, and providers can now narrow down specific information regarding their specialty. It gives providers an easy way to view patient information and track and view changes. It also reduces the number of clicks the user has to do. It's fully customizable, and I'll show you that when we walk through the setup. Meditech also provides a number of pre-built panels as well that can be utilized by your individual sites. And this comes standard, but can be edited based on your user. So now we're going to go into the software here. So I'm going to briefly go over what the EMR looks like. Hopefully everybody can see my screen here. All right. I'm going to pull up my patient here. So we're in PCM. I'm going to pull up my test patient. And I have this set to default automatically to the clinical panel for the patient when we pull into PCM and we pull up an account. This is the basic overview of what the clinical panel looks like. Before I go into this and some of the options here we have for expanding and contracting different fields here, I'm going to walk you through the various panels within EMR. First panel, we have the summary panel. It's going to give little information on the patient, kind of an overall review of that patient's visit, medications, allergies, etc. I'm not going to go too much into detail with these panels, but it's just an idea of what these clinical panels are going to actually pull from. We can go over a brief review of the visit here. If anybody is live with 6.1, this is the patient message and tasks panel within the EMR. So this will show any pertinent tasks or messages regarding this patient. We also have the history and problems panel. Any new results done on a patient will also pull into the new results panel. Our vital signs for our patient that were recorded during this patient's visit will pull to our vital signs panel. Any intake and output done on the patient will pull to our I&O panel. All medications for this patient will also pull into our medications panel. There's also a lab panel, so any documented information on this patient's lab results will pull into the lab panel. Any microbiology work done will pull into the microbiology panel. Same goes for blood blanks. Sorry, I don't have any examples to show you here, but blood bank information will pull in here. Any reports recorded on that patient will pull into our reports panel. Then we have our patient care panel that will pull in notes and vital signs, anything done in PCS, interventions, etc. And then we have our notes panel, which will pull in simple notes done on this patient. So rather than have to click between tabs here, we have the option to view certain information regarding the way we depending on the way we set up our clinical panel, to pull directly into the clinical panel so we can get a snapshot of information we're looking for our patient. So I'm going to go over briefly some of the options we have within the clinical panels, then we'll go into the build here. So from the bottom, if we click the Panels tab, there's also a preference to pull up a specific clinical panel, which I'll show when we walk into Access and Preferences and Parameters. But I have this set up to pull into my specific clinical panel, which is my test one that I have here. I have this set as a favorite, but you can manage your favorites through here and just check off which ones you want to pull in as your favorite. Then we have the standard list of all the clinical panels that we have access to. So you can see everything is contracted here. That's also a soft setting, but we can expand these. And this is just kind of an example of the type of information we can pull into our clinical panel. It might make more sense to have it contracted. As you can see, you kind of have to scroll through all this information if you were to open it expanded. You can click into a specific result or item that pulls in and see the history viewer and the exact details of that result that's pulling in. We can expand the width of our columns, which will show more results here. We can also make them smaller. The graph icon opens up the individual panels here, expands them. We can use the arrows to go back and forth between days. On the bottom here, we can view it, the results here listed in the clinical panel in increments, goes by 15-minute, 30-minute, an hour, 4 hours, 12 hours, or 24 hours. We can also graph individual vitals as well. There's an example here. If there is a result, for example, we have a vital sign here showing in yellow, that will be at normal level, and then red would be a critical level for a particular result. We have this plus icon here. That means there's additional documentation. And we also have the ability to view a report directly from our clinical panel. So in order for these individual items to pull, here's our report example, to pull to our clinical panel, they have to have an EMR ID associated to it. So I'm going to kind of go over what EMR ID is and show you how they map, but it's how these individual items will map to the EMR. We can view our current EMR version through this pathway: clinical dictionaries, EMR PCM, items and map reports, and current EMR version. This test string will be up to date. I believe we're at 887. It might be a little higher now. 889, I think, was our current. If you're reviewing to see what version you're at, and if you're at a lower number, or if you're well off from this number, we would suggest you update to the current version. Consult with your EMR specialist, and they can easily load that in for you upon change control given. This is going to get all the most recent up-to-date EMR IDs. So we create one every new version. There's new ones created. Typically, they're requested by site, but those are all thrown into the current EMR ID version, and all sites will get any new EMR ID that's created. But if we go to the EMR item view, I'll show you individual EMR ID. I'm just going to pull up a random one, for example. And this is going to give you general information on how this EMR ID is set up, what dictionary it looks to, what department it's a part of. It'll also, if we click the panels tab here, you can see which specific panel this EMR item belongs to. So this belongs to the diagnostic imaging panel, and that's where it's associated. It tells you what version it was released with, when it was created as well. All right, now that we went over a brief overview of the EMR, how a clinical panel will look, I'm going to show you some brief setup for our clinical panel, and then we're going to go over some demonstration for workflow in between our setup as well. So I'm going to show you my pre-built oncology setup clinical panel. So when we create one, if we're creating a new one, we'll hit new, give it a name, make sure it's active. We have various display options. There's standard, ED, and extended care. This shows how the time increments will display within the clinical panel here. These time increments right here. Extended, anything acute will display an acute patient stay, so the entire length of their stay. And extended shows longer, where you would need to view more results. So we can also choose which time interval to default into. If you notice, when we pulled up to my clinical panel, we automatically went to the 24-hour time frame. That's obviously a soft set, so we can just click into a different time frame here. But here we can choose which way we're going to default in. Excuse me. And here are some default options here as well for the number of columns that will display, the label width for each column, and how we want our INO cumulative display to show up. So INO cumulative, I have this attached to my clinical panel as well. On the bottom, if I expand cumulative INO, it will be displaying for the 24-hour increment, because that's how I have that set to. We can also, that can also be set to length of stay as well. We can also restrict to users, so we can restrict our built clinical panel to specific users, and only they will have access to them. So moving on to our components tab, this is where we're going to start our setup. You can see there's various types and options that we can add to our clinical panel. We have INO assessments, assessments that can be done on patients in PCS through interventions. We have a lab panel, which I was going over when I went through EMR ID overviews. We could pull up an entire lab panel or a report panel. We also have the option for group type clinical panels, or clinical panel groups, excuse me. There's also, we're going to go into clinical panel groups in a second, but just so you know, just so you can see, there's also the ability to pull up the entire MAR for that patient as well. So I am going to show you, one sec. I'm going to quickly show you a clinical panel group that I have set up. So I have these various clinical panel groups listed here, and I'm going to pull up one for an example. Excuse me, before I show you this, I wanted to show you how an assessment will pull onto our clinical panel. So if we're going to document an intervention, we're going to go into PCS. So we're going to access the PCS status board from the main screen. Sorry, I'm backtracking a little bit, but I just wanted to demonstrate how an assessment will show up on our clinical panel here. So I'm going to find my account. Pull up our patient's chart here. Go to our work list. So as you can see in my clinical panel dictionary, I have the assessment on.safety attached, and that's my pre-built assessment here. And it's attached to hopefully I had know which one it's attached to, but I'm pretty sure I guess we'll find out when I do it. It's attached to our oncology psychosocial intervention. So I'm going to document on this, and I'm just going to select random options here. Save and exit. Successfully documented on that individual assessment. I also have the assessment of vital signs attached, which should be attached to vital signs intervention here. So I'm also going to document on our patient's vital signs. Again, I'm going to put random information here just as a demonstration on how it will pull across. Excuse me. We'll save and exit here. And now we've successfully documented on these two interventions. And I will just follow the suggested order that's attached to that intervention. All right, now we've successfully documented on both interventions. So I'm going to go back into PCM. I just X'd out a bit so it will refresh. Sometimes there's a little bit of lag time, but it should be on our clinical panel. Excuse me. I will pull up the patient we were looking at. And now we are in our clinical panels here. I'll expand our vital signs. You can see I just documented right here. And our vital signs are pulling through. And this was our other assessment that was attached. And that successfully is pulling forward into our clinical panel as well. So that's how an assessment will pull, so we can document on various interventions and have whatever assessments we feel necessary as specific to the provider that would help them track patient information and pull it to their clinical panel so they can get a snapshot overview of where they're at. All right, coming back to our clinical panel dictionary, I'm going to next go over clinical panel groups. I have a few here that I'm going to go over, 3 of them actually. So with a clinical panel group, we can link various types of individual items we want attached to our clinical panel, and it will pull it in all together. So we can do a lab item, a report item, a medication item. We can do it in an entire lab panel that can be pulled into a group, just like it can be pulled into a clinical panel individually. We can also pull in a note, which I'll be going over, a query, or a query group. So for example, excuse me, I'm going to go over pulling in a individual report item, specifically the PET myocardial item. So I will show you where this EMR ID is pulling from. So in ITS, it's going to pull through a transcribed report. So I'm going to pull up our, I'm going to pull up our report dictionary in ITS. That's ancillary ITS dictionaries, P through Z report. Enter edit. And once this pulls up, I'm going to select the department that this is associated with. And I'll pull up a specific report template. And here you can see the EMR no procedure name, and this is that individual EMR ID. So now that we know documenting on this report, we'll look to that EMR ID, which will pull to our clinical panel. So now I'm going to go into our transcriptionist desktop and actually document on the report. And that's ancillary ITS transcriptionist desktop. I will find our patient. We'll look to the account. And I will begin documenting on my patient. So we'll look to the correct report template that the EMR report item was associated with, the PET report, and just fill out the various required information here. I'm going to put it in assigned status. And I'll just edit some sample text on the report as well. Save our report here. I'm going to give it a sec, but just so we have a chance for it to flow over to the EMR. The reason this EMR item will pull is because the individual report item, you can see it here. I have entered the PET myocardial entry here. So now I'm going to go back to PCM. I'm going to close out and go back in, and hopefully it will pull to our clinical panel here. Pull up my patient again. And that should be a part of our oncology reports group. And here we can see it pulling through the PET myocardial EMR report item. And you can click on the report again. We'll pull up the report. It's also going to pull to another section of my clinical panel because I have the entire panel group for diagnostic imaging pulling through. Here's my report example. So if I open up the diagnostic imaging panel, you'll see it listed here as well. So that would be the individual EMR, the report item, and then since the report item belongs to that report panel, that's why it's pulling in both places. Okay, going back to our clinical panel groups, I am going to pull up my other clinical panel and show you another example of items that we can have attached. So MD Oncology number 2 will pull up. And here you can see I have lab items attached. So now I'm going to demonstrate how a lab item might pull through. So I'm going to go into lab, ancillary, laboratory, and then we're going to go to requisitions, and then enter, edit, and result. So we're going to enter and edit a new result on a patient. Specifically, we will be doing our white blood count because that's the specific item I have attached for lab. I'll pull up my patient in lab. It's going to be a new rec number, so we're doing a new result. And I'm just going to go through the various fields here. And we'll pull up our white blood count order. We'll save it, and we're going to enter our results after we save it. The requisition was filed, and I'll enter the results. I'm just going to enter critical results so you can see how it will pull through in red, just to notify by the color that it's a critical result to the provider. And that would be the reference range here, and we get the prompt that it's critical result. Save it here. And it will file, and then it will pull to our clinical panel. Again, I'm going to X out a PCM and give it a second, but you can do various lab items. If there was a certain provider type that was only looking for specific results, this would be a way to help them look at specifically those results, narrowing them down without having to pick through all the lab results. I also have the entire lab panel attached here too, so it's going to pull up all of our lab results that are associated to that lab panel of hematology. Excuse me. Going back into PCM, pull up our patient again. I'm just going to figure out what the group called. So the name of this group is Oncology Labs. And there is our recorded lab result here. You can click into it for a history viewer and see past documented white blood counts on our patient as well. And again, it's in the critical color of red, indicating it's the critical result for the patient. So the different types we can add to our clinical panel groups, I believe I have a result. I already went over this, but the next I'm going to show you is note query, and you can also do query group, but I'm going to pull up my third clinical panel group. And I've touched on pretty much every type, but I want to briefly go over how we can get a note to cross. We'll also do a query as well, but these are the other types you can pull through. So let's document on a note and see how it pulls forward. So going to PCM, we'll go to our document panel. We'll do new. Since I have my clinical panel group, we have the note of ONC, the oncology nursing note, and I already have this here saved in my favorites, but I'm going to click it and just document. Just put some test text in there. Save it, sign off. We'll give it a sec to pull through. I tend to find it goes through a little quicker if I hop out of PCM, so that's what I'm going to do. Pull up my patient again. And name of this clinical panel group was Oncology 3. And here we have our oncology nursing notes pulling through. And there's the one I just did. And again, we can see it here. We can access the report and view it. And one more example and workflow I'm going to go over is an individual query. If we document on this query, specifically the entire doc section, the query will pull through, and we can, it's an easy way to indicate certain piece of information that provider wants to see. So the next part I'm going to show you is documenting on a query and showing you how it pulls through the clinical panel. So back into PCM, we're going to go to the document panel. I know I have this query of power of attorney Yes, power of attorney is attached to this document here. It's just a simple test document. Of course, someone's using the screen. All right. I'm going to find my query here and document on it. I'm going to sign off on this report. I just have to fill out all required questions, sign off on it. Again, I'm just going to hop out of PCM, go back in. Pull up my patient here. And here we have our power of attorney answer. So that's where that query is pulling from. So these are some basic setups and workflows that we can use when setting up our clinical panels. Again, this is just a basic overview of the individual types that we can attach here. But depending on the specific provider's workflow and what exactly they're looking to do on a patient, it makes it easier to find those pertinent information that that particular provider or provider group is looking for. So now I'm going to go over some access settings we can set up. So coming back to our main screen here, we're going to go to our EMR access dictionary. I'll pull up my access. And in the main tab, expand this here. In the main tab, we have the clinical panel field here where we can select specific panels that our EMR access will have enabled for them. So for the EMR access of all, whatever we have pulled out here, this access can access them. Next, I'm going to show you some parameters. So we'll go to our EMR parameter dictionary. And we have a couple fields here. The clinical panel INO offset hours from 2400. This defines the start time you want to offset from the 2400 hour period. For an example, a nurse's shifts might start at 7, so you can put 7. The next field we're going to look at is the clinical panel INO combined IV instances. Excuse me, to allow the system to combine IV medication instances into one entry when the generic name, identifier, strength, and route are the same, you would enter yes into this field. So then we're finally going to look at some user preferences within the EMR's user preference dictionary. I'll pull up my preferences. And then in the default, you can see why it was launching to the initial panel here was clinical panels because I had that set to initial panel default of clinical panels. The clinical panel start, you noticed how when I launched into my clinical panel, it was contracted. We can set it to expanded as well. And here we would list the default clinical panel you would want listed for that user. And there's my example, and that's why when I went in there, that's the first panel I defaulted into. So these are the basic settings in EMR Access that you can play around with as well. So I'm just going to wrap up here, and then we'll take a look at the questions if anybody else has some. I think I see a few. So as a recap, we defined what clinical panels are. I described some of their functionality. We walked through the clinical panel and clinical panel group dictionary, and I showed you some workflow that providers can utilize, and I described some particular users access that we can have set up as well. All right, so let's see if some people had questions here. Do you have to build a duplicate doc session for the EMR clinical panel? You wouldn't have to build a duplicate doc session. I'm not exactly sure what you're referring to when you ask this question. Can you be more specific? Are you talking about when you add the assessments? And that question was for Holly. I'm responding to Holly Griffin's question. If you're referring to attaching a query to a specific doc section, you wouldn't have to build a duplicate one. You can utilize that same query within that doc section, and depending on what their clinical panel is set up to, that's what it will pull. But no, it doesn't require you to ever have to build a particular doc section. I think that's what you're referring to as well. Correct me if I'm wrong. Does anybody else have any other questions? If you're referring to the assessment created, yes, you can create a specific assessment when it's flowing, if you want that to flow to the clinical panel, though I don't necessarily think it is required to create a duplicate, but I can follow up with you on that. Just in case I'm wrong, Holly, what is your site mnemonic? Okay, great. So I will open up a task and I will follow up with that question. Just don't want to give you inaccurate information, but I'm going to look further into that. All right, do we have any final questions? All right, so Holly, I will follow up with you. If anybody has any questions regarding setup, please reach out to your PCM or EMR specialist, and they can work with you to create the best clinical panel and show you how to utilize it to the best options. So I appreciate everybody joining today. Thank you. Bye.